back I started practicing yoga, and only 23 years back I started teaching yoga. So I have finished only 2 tapas, 24 years. 12 years is 1 tapa. Okay. So this is my experience, only 24 years, and I am a beginner. I hope you'll accept me, my teaching, and you'll be ready to learn from the one of the junior most yoga teacher. I hope. So let us start. Asana practices. We are going to share some PPT also with you so that you can understand it much better. Asana practices, during asana practices, what we are considering ourselves, not only at the physical level, you should consider yourself at the mental level, psychological level, emotional level, intellectual level. That is the spiritual aspect of asana. That means, in short, body mind coordination is important traditionally. As Keval is following the tradition and science together. That was the vision of Swami Kolananda. He started that scientific research. After that, Sri O.P. Tiwari, after that, Sri Subodh Tiwari, all are following the same lineage. And that is why I am also considering the same subject, that scientific understanding of the traditional practices, that is the traditional lineage of India, that is yoga. During asana practices or any kind of dynamic movement or static, be it asana practice, be it gym, be it the workout, any workout, jogging, walking, we people are considering the capacity of the superficial muscles, external muscles, big muscles. Naturally, bigger is the muscle, bigger is the capacity, bigger is the strength, bigger is the stamina. But while giving certain moments, especially to the spine and to some small joints of the body, the internal or the core muscles are very small muscles. The example of those core muscles is the multifidus. Those muscles are connecting your vertebrae to each other. When you are using your superficial muscles, external muscles, for example, your back muscles, trapezius or your pecs, that time you are naturally using the big capacity, and with the help of your bigger capacity, bigger jerk, bigger moment, that is the overwork for those small muscles. They don't have that much capacity and they are getting injured. That is why if you look at the injuries are happening in small muscles, inner muscles, core muscles, not at the superficial level. And it is not happening during asana practices only, it is happening during any kind of sports injury, any kind of accidental injury. Injuries are happening at the core level, not at the superficial level. That is why we should connect yourself in a proper way. Which kinds of muscle, group of muscles should be activated, not tensed. I am saying activated. Okay, there is a difference in activation of the muscle and tension of the muscle. So muscles should not be tensed, they should be activated in a proper way. In certain asana practices, certain muscles are getting contracted, certain muscles are getting stretched, certain muscles are getting toned up, but there are other muscles of the body which should remain relaxed, like facial muscles, like your hands. Okay, so that is important. Which parts of the body should be relaxed, which parts or joints or muscles should be utilized, which muscles should be activated during certain moments, and which should be relaxed. That understanding is important. As all of you are yoga teachers, yoga instructors, yoga therapists, different, and you are from different parts of countries, not only country, different parts of the world. Some people are just starting the day. So good morning to all of you. Those who are in India, now you are in the evening time. So throughout the day, your body is warmed up. Those who are in the morning time, their body is relaxed completely. So maybe little stiff. Doesn't matter. You should prepare your body in such a way that anytime, be it midnight, be it early morning, morning, afternoon, evening, whatever, your body should be ready to perform certain asana practices very easily without any injuries. Actually speaking, asana practices or yoga practices are for the prevention, okay, and not for the injuries. Nowadays, we have different injuries occurred because of wrong asana practices or modifications of asana practices. What I am going to do is, I am asking you to practice certain asanas. Only 4 to 5 asanas you are going to perform. Here we have one demonstrator also. He will also perform the same asana practices in front of you. You will be able to observe him. But as all of you are yoga teachers, instructors, or therapists, whatever, or yoga masters, I don't know. But today and tomorrow, you are going to learn how to become a yoga teacher from the yoga instructor. If you are an instructor, then how to become a yoga teacher. If you are a yoga teacher, then how to become a yoga therapist. If you are a yoga therapist, then how to become a yoga master. Okay, that is our intention. So that how to progress yourself properly. That proper progress is important. So we should have a proper understanding of our body and mind. Union of body and mind is yoga. So here you are going to concentrate on yourself, on your body. You are going to unite your mind with your body instead of wandering here and there. And then that body mind coordination is going to happen and actual yoga is going to happen. So all of you, please lie down on your back in a supine position. Adjust your cameras in such a way that I can observe you fully. Keeping your legs together, hands close to you. And now, please proceed for Ardha Halasana with both legs. So you are going to lift your both legs. I will request all of you to keep your videos on. Audios will be muted, but keep your videos on so that I can observe you. Okay, now you are going to proceed for Ardha Halasana with both legs. Slowly lifting your both legs step by step as per your capacity. And if it is possible, reach up to 90 degree. Keeping your knees straight as much as you can, as per your capacity. Slowly come back. Purposely, I'm not going to give any instruction for asana. Now, I will give the instruction afterwards. After 4 to 5 normal breath, now prepare yourself for Setu Bandhasana, bridge pose. You are going to practice bridge pose, Setu Bandhasana. Now you can proceed. Show me your Setu Bandhasan bridge pose, how you perform, how you have learned, doesn't matter. You proceed. Not necessary to look at the screen in between. Okay. So don't disturb yourself. Be comfortable. Please release. Keep your knees bent. Now, as a counterbalance, proceed for Pavan Muktasana. Pavan Muktasana. Please come back. Again, relax for 5 to 6 normal breath. Now turn on the abdomen, come in a prone lying position and proceed for Bhujangasana, Cobra pose. Come back, please. Relax for a while. Now, with the help of your hands and knees, come in sitting, sit back on your heels in Vajrasana. And proceed for Parvatasana, mountain pose. Parvatasana, mountain pose. You can follow your steps. Doesn't matter whether you are proceeding from front of the chest, from side of the body, doesn't matter. Come back, please. Come in standing now. And try for Tadasana, palm tree pose. Your way of practice. Don't try to follow him. Tadasana, not Rikshasana. Tadasana only. Okay, please release. You can come in sitting and relax. Okay. So thank you for showing me some particular asana practices. Now we are going to understand some particular things, some particular connections, that scientific understanding. So let us start with the PowerPoint presentation. The first presentation I am going to share with all of you, in which in the first slide, what I am saying is how to become a yoga teacher from a yoga instructor and how to become a yoga therapist from a yoga teacher. Okay. So first, the knowledge of anatomy, physiology of particular muscles and joints is necessary as a yoga teacher. This is my understanding. Then, because of either lack of knowledge or because of less knowledge, or maybe because of the wrong knowledge or insufficient knowledge about the subject matter. What is our subject matter? Is our asana practice. So something is different in our workshop, that you will understand. So we teach in a wrong way or incorrect way, and your clients, your students may have some problems, some injuries. There are so many cases happening in the world that because of those wrong practices of wrong yoga teaching by the teacher, people are suffering. So to protect yourself, your client, your patient, your student from certain injuries, we can apply some particular anatomical connections. Okay. That anatomical connections in our yoga practices, in yoga teaching, in our yoga teaching is important. Okay. Next slide. So as the definition of asana is sthira sukhamasana, of course, we should follow that. Even we should follow the prayatna shaithilya ananta samapatibhyam also. For the stability, what you need to perform asana, what you need? First we think, no, I need to improve my flexibility. No. First, to perform any kind of asana practice, you need the proper strength in your body, in your muscles. Then you need a stamina to maintain that position for longer time. And then the flexibility will come automatically. That means you need strength, stamina, and flexibility all together. Only flexibility is not useful. It will not work. Only strength is also not useful. Or only stamina is also not useful. All three should be there. Then only you can perform asana, you can maintain asana, you can stretch your body, your muscles properly, and you will get the proper benefit of asana. Then, for the progressive stability, awareness about your particular muscles in a particular asana is important. What I was explaining in the beginning, that in a particular asana practices, particular parts of the body, joints, muscles of the body are working or should work, and all the other muscles, joints, and parts of the body should be relaxed. That is important. Activities of the muscles like contraction, stretching, relaxation, those are different activities of your muscles. So which muscle should contract, which should be stretched, which should be relaxed? So those things should be kept in mind during asana practices. Next, please. This is our vertebral column. It's a front view, back view, and side view. So if you look at the natural curvature of the vertebral column from the side view, from front and back side, it will be a straight line. But from the side view, that is the curvature which should be maintained. But nowadays, because of our very good habits, sitting on the chair, especially in a luxurious office, luxurious chair, rolling chair, and then we are sitting like this, and then we are working with the computer in this way, very nicely. Yeah, all the time throughout the day, your spine is in a C shape. You are sinking down completely. What is happening with that spine when you are sinking down all the day? This curvature, C curvature of the spine. And because of this sinking down, the kyphotic curvature is increasing more and more day by day. And you are losing that natural curvature of the vertebral column. The flat areas are developed in the lumbar spine. There is no curvature in the lumbar spine nowadays. And then all the nerve endings coming out of the spine from front side, they are getting compressed. And then you suffer from cervical pain, cervical spondylitis, lumbar spondylitis, these, that, spinal problems. Okay. So to protect yourself from certain problems or injuries in the spine, sitting straight, maintaining the natural curvature of the vertebral column is important. Next slide, please. Now, in our vertebral column, how many moments we have? Basic 6 moments. Which are those? One is forward bending, that is flexion. Second is backward bending, spinal extension. Then we have side flexion, right side bending, left side bending. Then we have rotation, twisting, right side twisting, clockwise rotation, left side twisting, counterclockwise rotation. These are 6 basic moments in our spine. In our daily routine, analyze yourself how many moments you are covering up and in which shape of the spine or in which moment of the spine you are repeating throughout the day. Mostly in a forward bending, sinking down. Is it? It is very necessary to cover up all those 6 moments. Now we have certain terminologies which we are going to use in our regular yoga teaching now onwards. Which are those? What is the origin and insertion? So there are particular medical terms for our muscles or for our body organs or joints. So the origin means the beginning site of the more fixed end of the muscle. So the muscle, for example, if my bicep muscle here, so where is the origin and where is the insertion of that bicep muscle? Bicep starts from here and then insertion is here. So that is why, because of the contraction of the bicep, my elbow joint is getting flexed. Okay. So this is the terminology, origin and insertion of the muscle. What is the superior and inferior? Superior means towards the head or towards the upper part of the structure. Then inferior means away from the head. Inferior, superior and inferior. Okay. So away from the head side. Then anterior and posterior. Anterior means your front side of the body. Posterior means the back side of the body. Okay. Then we have medial and lateral. These are the terms. Medial means towards the midline. Means this is the midline of the body at the center. So towards the midline, medial. And lateral. For example, for our knee, we have the ligaments or we have the meniscus. So this is the medial meniscus, this is the lateral meniscus of the knee. So the medial and lateral. Then we have the proximal and distal ends of the body or of the particular area. What is that proximal and distal? Proximal means close to the joint, upper part. For example, if I am talking about this part, which is close to the elbow joint, then this is the proximal end of the my forearm, and this part, wrist is away from the elbow joint, so this part is away from the elbow joint. This is the distal part of the my arm from the elbow joint. So proximal and distal, close to the joint, away from the joint. Okay, next slide please. Then we have external and internal. That is very easy to understand. Okay, so superficial, external means superficial, and internal means inner or inner surface or core. Then we have plantar. Plantar means your soul is towards the sole or towards the sole of the foot. Plantar. Okay, so actually we have only one moment of the ankle joint, which is known as flexion. This is also flexion of the ankle joint, and this is also flexion of the ankle joint. Both are flexions, but this is known as plantar flexion when your toes are pointed, whereas when your toes are towards you, it is known as dorsiflexion, dorsiflexion and plantar flexion of the ankle joint. Okay, then about the muscles, contraction of the muscle, there are terminologies known as isotonic contraction and isometric contraction. Isotonic, in which the tone is unchanged, tone of the muscle remains as it is, but the length changes. Either muscle is getting shortened, means contracted, whereas in isometric contraction the length is unchanged but the tone is changed. For example, when I am tracking my patella, pulling the kneecap, that time my front thighs are activated to keep the knee straight, quadriceps are activated to pull the kneecap. That time my front thighs quadriceps are in a isometric contraction. This is the important thing to keep your knee straight. Then we have certain moments in our scapula, in your scapulae. That is, we have elevation of the scapulae, lifting your scapulae up, lifting the shoulders up. We have tension also in our shoulders when unnecessarily you are trying yourself forcefully and then shoulders are hiked up, then this is the tension in your shoulders. But purposely, carefully, when you are lifting your shoulders up, that is the elevation of the scapulae. Then depression. Is it depression? Not mental. Okay, because you are aware about the mental depression only. So this is not the mental depression. That is harmful. We need the depression of the shoulders, okay, of the scapulae. So elevation, then depression. Then we have the term protraction, in which your shoulders are coming in front, means your shoulders are rounded forward. That means your scapulae are going away from each other, or scapulae are going away from the spine. That is protraction. For example, when you perform Shalabhasan, locust pose, when you perform Mayurasan, peacock pose, that time your shoulders are rounded forward or your scapulae are in protracted position. Then the counter moment is your retraction of the shoulders, in which your scapulae are coming close to each other, scapulae are coming close to the spine or towards the center line. That is known as retraction. For example, Bhujangasana, Dhanurasana, Ushtrasan, in those backward bending asanas, scapulae are retracted. So these are certain terminologies we are using in our yoga teaching. or we should use, or we should understand those terminologies properly. Now, what are the important joints during asana practices? When we perform asana, of course, our spine is important. Apart from the spine, shoulder joints, elbow joints, hip joints, knee joints, and ankle joints. These are the important joints which are getting utilized or worked out during certain asana practices, different asana practices. Next slide, please. So, we are coming towards all those joints one by one. Now, let us discuss about the shoulder joint. If you know, nowadays there is one big problem in the world, and that new shoulder pain is developed because of certain asana practices. But it is known as Ashtanga shoulder, if you heard about that. Okay. And that Ashtanga shoulder means if you are not aware about the stabilization of the scapulae properly, and if you are taking the body weight on your shoulders to lift yourself, and unnecessary, because of the unnecessary tension in your shoulders, it creates pain, and then it damages your those ball and socket joints, and you develop the shoulder pain. So it is known as that different problem nowadays. By the name of yoga, there should not be any injury. Okay, this is very sad thing. So please be aware and don't dilute it. Okay, please. That is my purpose to conduct this workshop. Now, in our shoulder joint, apart from scapulae, this is the only joint, shoulder joint, which is having the biggest range of movement. Okay. This much range of movement we don't have in other joint of the body. Then the second number, the biggest range of movement is our hip thigh joint, because these two are only the ball and socket joints. Okay, those balls are fixed in the socket. That is why we have the big range of movement in our hip joint also. But biggest range of movement is in our shoulder. But our hip and shoulder joint don't have any other bony attachment, any other lock for the movement. For example, for the elbow joint, this is the maximum. Now it is locked. Bony attachment is there. So it is locked here. For the knee, it is locked here. So there is a protection, natural protection. But for the shoulder and hip, we don't have the lock. Then by the surrounding muscles, those scapulae are sliding and gliding. Okay, that is why you should stabilize your scapulae properly, and it is necessary to strengthen your surrounding muscles of the scapulae so that you won't have any injury in your shoulders and in your scapulae. Scapula is just like a triangle shape, and only clavicle, this collarbone, is touching it here. And if because of some jerky movement, you are because of some wrong habits, especially for the ladies, if they are habitual to carry the purse or a bag on one shoulder only. So many times, many ladies, we observe that they are like this. Okay, automatically. People who are carrying the computer bag, laptop bag, they are also, one shoulder is down, one is up. This has become the natural position for them. Okay, so one scapula is going down because of that habit. Okay, and because of that, the spinal scoliosis also may develop. That is why you should have the habit of carrying on both shoulders alternately, or better to carry a sack on the laptop bag. Okay, so this shoulder joint, especially your deltoids, anterior deltoid, medial deltoid, and posterior deltoid. In our next slides, we have those muscles, picture of the muscles. So those muscles are important. Then the group of 4 muscles known as SITS, that is supraspinatus, then pectoralis minor, then infraspinatus, and teres minor. Those muscles which are utilized or which are working for the rotation of the shoulder joint. If those muscles are not strengthened properly, or they become stiff, then during asana practices, surely you'll get the injuries. Okay. In the same thing is applicable for the hip thigh joint also. In our greater trochanter, means the ball here at the femur. So that part of the hip or the surrounding muscles of the hip joints should be stabilized and should be strengthened properly. For that, we have certain moments or certain exercises available on YouTube or on the internet also. You can go through those exercises. Okay. Now, next slide, please. We are going further for the other joints also, one by one. So, which are the muscles involved in the movements of the vertebral column? A series of pairs of small muscles extending the full length of the spine just superficial to the rotators and each spanning 2 or 3 intervertebral spaces before the insertion or inserting them. So the insertion of the muscle. So origin and insertion of those muscles multifidus. Those are the very small muscles like this. They are crossing each other like this, like this. Okay. As you tie your hairs, in the same way, those muscles are crossing each other and they are connecting your vertebrae, crossing. So whole vertebral column is getting connected with those multifidus muscles, very small muscles, but it's a big group of muscles. But individually they are very small and they are having very less capacity, and you get the injury in those muscles only because of jerky movements of the superficial muscles. Next slide, please. So these are the particular back muscles, names of the back muscles. Don't get confused about the name of the muscles. Okay. You just say the back muscles, neck muscles, or lower back muscle. That's it. Okay. So levator scapula, trapezius. Trapezius muscles are upper division, medial division, and lower division. Okay. These are the upper back muscles. Then your rhomboid major and minor. Then erector spiny group. Your erector spiny group are from here to the here. So your whole name of the muscle is erector spiny. So it makes your spine, it keeps your spine erect. That is why erector spiny muscles. Okay. Then latissimus dorsi, or in short, they are known as lats. Okay. And this posterior and anterior serratus muscles. These are the important muscles in your back which are helping you to keep your back straight or sit straight. And for the movements also, these muscles are helping you properly. Now, next slide, please. So in colors, you will get the particular muscles with those colors. You'll understand them properly. Okay. You can see the lats or latissimus dorsi. In that yellow color, you can combine that color and where that color is showing, okay, in the body structure. Then the teres major and minor muscles in the upper part. That means above the scapulae. So your scapulae are getting moved because of those muscles only. Then the trapezius division, middle and lower division. Upper division is in the next slide. Then infraspinatus and erector spiny. Erector spiny is at the lower back, whereas the infraspinatus is at the upper back. Next slide, please. This is the back side. Now for the neck muscle, see the longest muscle which is coming from the lower back, from the pelvis till the neck, that is erector spiny muscle, the long muscle. Where the trapezius, the middle division is at the upper back here, just below the neck. The next slide, please. From upper division of the trapezius now in the blue color, and then the medial deltoid, posterior deltoid, those shoulder, medial green color is here, and the posterior deltoid in the light color here. and then the next slide, please. From the front side, that is anterior deltoid in a green color here. So medial deltoid is in the dark green, and anterior deltoid is in the light green color, whereas the trapezius upper division, upper fibers are here, the side muscles of the neck. Mostly if you take a pillow in a wrong way while sleeping, in the morning you get the muscle pull or catch in the neck. That is because of that muscle which is getting contracted unnecessarily, and you get the muscle injury. Next slide, please. These are two positions of the body where the shoulders are protracted because of working for a long time with the computer, reading, writing, and whole day if you are sinking down. That is known as weak muscles or protracted shoulders. Shoulders are getting protracted and your muscles are becoming weak. Naturally, when you consider the rubber band, and if you keep stretching that rubber band all the time, what will happen? After some time, the natural length of the rubber band will increase. It will lose the elasticity, and the natural length of the rubber band will be, instead of 2 inch, it will become 3 inch. The same thing is happening with your muscles. When your muscles are always in stretched position, because when you are sinking down, that time what is happening? Your back muscles, your back side of the shoulders are getting stretched all the time, and front muscles are getting contracted all the time. Then after few months or years, this becomes their natural length. That means the natural length of the muscles increases and they become weak. And then when you try to sit straight after getting the instruction, for some time you sit straight. After that, because those muscles need to contract to sit straight, but that becomes the overwork for those muscles now, because they are already here, they are lengthened. Now this is the overwork for those muscles, and they get tired after few minutes, and then you feel uneasy, uncomfortable, painful after sitting straight. Okay, so that is why please be sure, make sure that you are sitting straight now onwards. Maintain the natural curvature of the vertebral column properly. Not only for your student, this is not only to give the instruction to your students, but this is applicable for you also. I asked you perform some asana practices. Purposely, I have not given any instruction for any asana practice. After understanding those terminologies, some anatomical connections, then again we are going to practice all those asanas, same asanas, but according to my instructions. Then you will find the difference. Okay, I observed all of you how you are performing, and again I will point out who was performing in which way, and then I will explain how to perform. Okay, next slide please. I think finished. Okay, now most important, abdominal muscles. How many muscles have you have in your abdomen? How many layers do you have in your abdominal muscles? So those answers you should know as a yoga teacher. We have 3 layers in our abdominal muscles. The innermost layer of the abdominal muscle is known as TA, transverse abdominis. TA, short form, transverse abdominis. Then after TA, there is a next layer of the muscle known as obliques, oblique muscles. Obliques are two types: internal obliques and then external obliques. So I am showing the area TA, transverse abdominis, internal obliques, external obliques. And the third outermost layer is known as RA, rectus abdominis. In the next slide, you are going to see the pictures of those muscles. So the TA, transverse abdominis, the innermost layer. You can see the green color, very small part of the muscle. Okay, that is the innermost. After that comes your obliques. So the inner part of that blue color muscle is known as internal oblique, and the side part of that blue color is known as external oblique. Now, if you look at the internal obliques, your TA, transverse abdominis, your internal obliques, external obliques, all those muscles are connected to your bottom ribs or the floating ribs. Those are the floating ribs. First, around means maybe around 10th, 11th, 12th ribs are floating ribs, and TA is connecting your the bottom rib, and it is connecting to your pelvis, your lower abdominal region, or the pelvis or the inguinal area. Whereas internal obliques are connecting your bottom ribs from both sides and connecting to the inguinal area here from both sides. And external obliques are starting from the floating ribs to the inguinal area, and they are running from both sides and getting connected to the lumbar vertebrae, lower back. When the person is having lumbar spondylitis or spondylosis or spondylolisthesis or slip disc, sciatica, and when you go to the orthopedic surgeon, what the doctor is suggesting you? To wear the lumbar belt. In that lumbar belt, there is a hard surface having some cushion area and having the curvature which is supporting your lumbar vertebrae. And while giving movement to the body, those lumbar vertebrae are getting protected properly, supported properly, and then you don't have any pain after wearing the belt. Or they are suggesting you to wear the belt throughout the day, especially while giving the movements. Only while sleeping you have to remove the belt. How many of you are wearing the belt? You can raise your hands. How many of you are wearing the belt? Nobody? Are you sure? Everybody is wearing the belt. The natural belt. We have the natural belt. Your external obliques is the natural lumbar belt to protect your lumbar spine. Yes. This is the natural belt to protect your lumbar spine. Your external obliques, connecting your lumbar vertebrae. That is why after practicing Kapalbhati, you get little pain in the lower back. Is it or not? Why? Because of Kapalbhati, with every stroke, the pulses of the strokes are getting conducted towards the lumbar vertebrae, and you get the lower back pain by practicing Kapalbhati. After practicing Kapalbhati in the beginning, not every time, not for the advanced practitioners. Or those who are having severe lower back pain, for them we say, don't practice Kapalbhati or take a cushion in the lower back. Why? Because those jerks are reaching to the lumbar vertebrae and you get the pain. So this is the natural belt, God gifted belt. Use it always, especially during asana practices or during any kind of jerky movement. And the outermost layer is your RA, rectus abdominis. When you or anybody go to the gym and the gym instructor is asking you, okay, what is your purpose to join this gym? Or what is your purpose to come here? Immediately you reply, I want to develop my 6 packs. Is it? But scientifically, it is not 6 pack. It's an 8 pack. Yes, this is 8 pack. This is the group of 4 groups of muscles. The bottom group 2 slots are not visible because of the underwear. That is why you don't consider those muscles, and you say only 6 pack. They are 8 packs actually. So you should have the strength in your all 8 packs, not 6 packs. So the next slide, please. So these are the abdominal muscles. Now in this slide, you'll see those 4 slots of the muscle for one side, and the same side mirror image you can consider to the other side. So these are the 8 packs of the muscle. Okay, so the TA, transverse abdominis, is the core muscle, the innermost layer of the muscle. What is the importance of that muscle? What is the use of that muscle? As per my understanding, to give any moment to the spine, be it forward bending flexion, be it backward bending extension, be it rotation, twisting, right side, left siding, or right side, left side bending, your abdominal muscles, especially your obliques, are responsible for those moments of the spine, or your obliques should work to give the moment to the spine. But our awareness is only on the back muscles and spinal muscles. During twisting asana, during forward bending asana, you say, my back is getting stretched. In Dhanurasana, Ushtrasana, you say, okay, my back muscles are getting contracted. For side bending, you say, my side of the torso is getting stretched, one side. For while twisting, you say, okay, I am getting stretched in the back muscle. But that stretching or contraction of the back muscle should be secondary. Primary movement should happen from the obliques, from the abdominal muscles, to protect yourself. Because I hope you know how many vertebrae you have. I hope how many vertebra in cervical region and lumbar region, in thoracic region. So the upper part is cervical region, 7 vertebrae, then thoracic region, 12 vertebrae, then lumbar region, 5 vertebrae, then the group of 5 vertebrae, that is your sacrum, and then your coccyx, fused 4 bones, tailbone. Considering your lumbar and cervical, we, as you know, cervical spondylitis, lumbar spondylitis, you must have heard about those problems. Is it? Have you heard about thoracic spondylitis? What is that? Anybody having thoracic spondylitis? Why? Why you don't have spondylitis, spondylosis, spondylolisthesis in thoracic region? What is the reason? Because your thoracic vertebrae are protected, are connected with the 12 pairs of the ribs. Your ribs are connected to the thoracic vertebrae. Because of that bony attachment of the rib cage, thoracic vertebrae are protected, and that is why they have the less range of movement. In thoracic vertebra, range of movement is very less as compared to cervical and lumbar vertebrae. Whenever you are giving movement to the spine, any movement, mostly movement is happening either from the lower back or from the neck. Biggest range of your spine is in your cervical and in your lumbar. More is the moment, more is the chance of injury. That is why either cervical or lumbar we get the injury, not in thoracic. They are already protected. Only in case of any accident, external jerk, then only they are getting injured, otherwise not. To protect your neck region, your cervical vertebrae, as we discussed about the stabilization of the shoulders and surrounding muscles, strengthening of surrounding muscles. One more thing, one more habit, especially those who are in a corporate and IT field, those who are working with the computer for a long time. For them, what happens? Because of their concentration in the computer screen while working, slowly, with the concentration, your head becomes forward like this. When you use a laptop in your office, while traveling, in your car, in the flight, or at your home, before sleeping also, Your laptop is on your laps, and the name is laptop. So before sleeping also, you want to do something with the laptop. And then when it is kept on the tabletop, the keyboard and mouse is there. So that is why your position is like this. Already your neck is here. And then with the laptop here, when you are working with the laptop on the tabletop, then slowly your position becomes like this. Okay. So you are hiking the shoulders, they are tensed, neck is already in the tension and forward, head is forward, and then you have strain in the elbows and hands also. This is the favorite problem. I am getting the complaints from the people from IT and corporate people. Okay. So these are the things which we are suffering from, or the people are suffering from and complaining about the problems. Next slide, please. So be aware about the position of your neck. Neck should be like this. Okay, in this way. Not here. Not jamming your chin to the chest also, or not throwing the head forward also. Natural position, natural curvature. So lengthen in the back of the neck and face in front looking at the eye level. This is the ideal position. Hmm? Then again, if you come to the slide, you'll clearly you can observe that obliques from the side views, front view, you can observe, and back view also. The oblique muscle, external obliques, how they are getting connected to the lower back or lumbar vertebrae. Hmm? Next, please. In the same way, your abdominal muscles, especially your lower abdominal muscles, how they are projected here. Hmm? You'll understand it. Next, please. Now remains your lower body. That means your legs, your limbs, lower limbs. For the lower limbs, we have particular biggest muscles of the body. That is, glutes are the biggest muscle of the body. Then your thigh muscles, then your calf muscles. Hmm? So thigh muscles are front thighs, back thighs, inner thighs, outer thighs, etc. So are the different thigh muscles. And then your calves. How they are working or how you have to stabilize them, we are going to discuss after a break. We have a break of 10 minutes. Okay. I hope you are enjoying and you'll enjoy the break also. And I am waiting for you. Thank you. Namaste and welcome back again. Okay. So we are discussing about our lower limbs now, or the biggest muscle of the body. Glutes are the biggest muscles of our body. Then the hamstrings, means your thigh muscles, and then the calves. Thigh muscles, we have front thighs known as quadriceps. Your front thigh muscles, quadriceps. Back thighs, that means hamstrings. We have two more muscles in your thigh that is known as adductors and abductors. Okay, adductor and abductor. Adductor, add, that means which are working to keep your leg towards bring your leg towards the midline or close to each other, and the abductors which are taking your leg away from the midline, away from each other, for the lifting your leg to the side like this. That time your abductors are working or getting contracted, whereas when you are trying to keep your legs together, that time your adductors are working. And for many people, not only people, for many yoga teachers also, your adductors are weak, and at the same time you have stiffness in the hip joints, because of which you are finding it difficult to keep your legs together. So to strengthen your adductors, we have certain modifications that we are going to practice. Okay, now we gone through the discussion of abdominal muscles, about the shoulders and scapula and neck, and about the thigh and hip muscles and calves. Now, how to connect your muscles or how to connect yourself to protect from the injuries? First thing, starting with the core muscle or TA, transverse abdominis. So if I am in standing position and I am just relaxing my abdominal muscles, nothing connected, complete popping my abs out. Here is my belly button. And from here, if I try to connect myself, I am trying to tuck my belly button in, then what will happen? See, only 1 inch my belly button is going away from my finger, and I am connecting myself. This one. From here to here. This gap. So it is not Udyan Bandha. In Udyan Bandha, you are sucking your abdominal muscles, contracting them completely, and there is no chance of inhalation and exhalation. Breathing is stopped completely. Whereas in this contraction, nothing is affecting on my movement of the diaphragm. My breathing is as it is. My diaphragm is working in the same way as it is. So only 1 inch I am tucking the belly button in. For that, I have to contract my perineal muscles, inguinal muscles, and lower abdominal muscles. To understand this connection, to tuck the belly button in or to connect your lower abdominal region or your transverse abdominis, very easy to understand. imagine when you want to stop the flow of the urination. Okay, when you want to stop the flow of the urine, that time you tuck the belly button in and your perineal muscles are getting contracted. That is the connection, literally. Why you have to connect this one? Because when your TA is connected, which is connecting your bottom floating ribs and your pelvis. So because of the connection of the TA, your rib cage and your pelvis are getting connected with each other, and there is no chance of going here or there, or extension or tilting or shifting the ribs. So many times your ribs are shifted. Okay, ribs are rotated or going away from the pelvis. So there is no chance of shifting your ribs, tilting the pelvis, because of the connection of the transverse abdominis. So before proceeding any asana, connect yourself, tuck the belly button in, engage your abs. These are my common instruction during asana practices. And after some time, when we are going to perform all those same asanas you have performed, at that time I am going to give the instructions, and according to my instruction you are going to perform the same asana practices. So this TA, because of this connection of the TA, transverse abdominis, now your internal obliques are activated automatically, and your bottom ribs and your inguinal area are connected. Because of this connection, your ribs are not allowed to pop out, floating ribs, bottom ribs. Otherwise, what happened, I asked you to perform parvatasana and tadasana. Okay, in parvatasana and tadasana, he is also not aware about the connection. He is also like you. That is why I will ask him to perform parvatasana, side view, face here, correct, here, face here, and go for parvatasana, final position. Okay, so in parvatasana, if you look at the stretch, so see, if you look at the curvature, this is extended curvature in parvatasana. Okay, or in tadasana also, what happens, please relax. So what happens when you go for stretching like parvatasana or tadasana? That time what happens? You get the instruction, okay, stretch yourself. In tadasana, you are stretching, and you are stretching, and unknowingly you are going in the spinal extension. Okay, and then what happens? You are popping the ribs out. Your ribs are popped out. Whereas if your TA is connected, internal obliques are connected, that time your bottom rib is binding to the inguinal area, to the pelvis. So when your bottom ribs are connected, pulled down, bound properly, there is no chance of popping them out. Then what will happen? When you are stretching yourself, intercostal muscles of the rib cage will get stretched because of the expansion of the chest, and this expansion of the rib cage will be to the lateral sides and posterior sides. When your rib cage is getting expanded to the lateral sides, your lungs will have enough space or more space for the expansion, and especially the lower lobes of the lungs, which are always underutilized. That underutilized area of the lungs, lower lobes of the lungs are getting activated or getting utilized, and that is why you are able to increase the lungs capacity. We say by practicing parvatasana is very good for bronchial asthma, to increase your lungs capacity. But if you are practicing parvatasana by popping the ribs out without connection, nothing is going to happen with your lung. Okay, if you are connecting properly, tucking the belly button in, your bottom ribs are connected to the pelvis with the internal obliques, and then when you are performing parvatasana, then only it is useful, and it is increasing your lungs capacity, good for bronchial asthma. So this is the position, right position. Whereas in parvatasana, if you are losing the connection of your abdominal muscles, and popping the ribs out, then it will be here. And with the connection, it is here. So this is the difference in Parvatasana and Tada. Parvatasana, Tadasana, Uttana Mandukasana, in those asanas where you are giving the natural traction to the spine. So instead of giving traction, you are going in the extension. Okay. So it should be a proper traction to the spine. So this is the importance of the connection of the TA, transverse abdominis, and internal obliques. Whereas external obliques means when you are wrapping your abs properly, naturally when you are connecting your TA, tucking the belly button in, and you are connecting your internal obliques, external obliques will work or connect properly automatically, and you are wrapping your abs. When you are wrapping your abs properly, your external obliques properly, that time your lumbar vertebrae are getting connected and they are getting protected automatically. Especially, for example, when you are trying for Ardha Halasana with both legs, and the newcomers or new people, what they do, they go with the jerk. Or those, actually, this is the human tendency. Instead of looking at yourself, you look at the others much. And then how the others are performing, that you are looking. And then the others, oh, he is reaching or she is reaching up to 90 degree easily, keeping the knee straight. So I should. But I have tight hamstrings, I have tight hips, and I can't lift more than 50 or 60 degree. Then pressing the hands on the down, then lifting the head, and then forcefully, actively, or dynamically you are lifting your legs, and you get the lower back pain. Many people are complaining by practicing Ardha Halasana, they get the lower back pain. Reason is because of the lack of connection. So if you connect your abs properly, wrap your obliques properly, you are protecting your lower back. Simple example, apart from yoga, if you are going on the road with the car or with the bike, and when your car is having the jerk on the bumps, what happens? Immediately on the speed breaker, if you are not aware and you get the jerk, and you get the lower back pain or any muscle pull. So because you are not aware about that. So instead of that, be connected. Make it your habit. Whenever you are giving any movement to the body, any jerky movement to the body, connect yourself. And this will help you to protect your spine, especially lower back. So that is why, as I told you, the chance of injury is in the cervical and lumbar only, not in the thoracic. So by stabilizing your scapula, by keeping your face in front, you are protecting your cervical region, and by wrapping your obliques, you are protecting your lumbar region. So there is no chance of injury at all during asana practices or by performing asana practices. So this is the importance of the abdominal connection. Now, buttocks, glutes. So, especially for the backward bending asanas, extension of body, your glutes and hamstrings, back thighs and buttocks, they are playing very important role for the stability of the hips. For example, if you want to perform Kati Chakrasana or backward bending Chakrasana, and during Surya Namaskar, for example, in Hasta Uttanasana or Ardha Chandrasana, in the 2nd or 11th position, when you are going up and going in the extension without any connection of the abdomen or glute, and when you are going, immediately it creates pressure on the throat, and breathing and talking becomes difficult. This is your experience also. Everybody is having that experience, that it creates pressure on the throat. If you are connecting your abs first, and then squeeze your buttocks and back thighs, squeeze your glutes. How to squeeze your glutes? How to understand to squeeze your glutes? Very easy. When you have some problem, when you are ill, having any disease, and you go to the doctor, and then doctor is giving you the injection and poking the needle here, how you perform, how your buttocks are performing, immediately you say, ouch, is it? So imagine 2 needles from both sides. Okay. So when you get two needles from both sides, that time your glutes will be activated and you will say ouch. Without saying ouch, when your glutes will be like this, okay, squeezed. That is the squeezing of the buttocks or glutes. And this is very important connection, especially for the backward bending asanas. And it will stabilize your pelvis also. So if you squeeze your buttocks and back thighs, hamstrings, and then if you are going in the extension, because of the connection, there is less pressure on the throat comparatively. Breathing becomes easy, talking becomes little easy. Okay. And one more important benefit of connecting your glutes is to maintain the body structure properly. That means the body alignment properly. What is that alignment? For example, when you go for the side bending chakrasan or konasan, lateral bending chakrasan or konasan, that time when you perform like this and you are asked to bend to the side, immediately while side bending, either you go here or you go here. So unknowingly, your pelvis is getting tilted. Many people are doing like this. Many people are doing like this. Okay. And we are not aware about that. Why it is happening? You go to the people, you correct them. No, no, not forward bending, not backward bending. Instead of that, you should know how to explain them, how to connect them properly. So if you connect from front side, if you connect from back sides, and then if you are bending to the side, immediately, automatically, your alignment of the body will be maintained properly with the connections. So glutes and hamstrings both are important for, especially for extension, backward bending, and for the stability of the pelvis. The counter muscle of the back thigh, hamstring, is your quadricep, front thigh. When your hamstrings are contracted, your knee is getting bent. Whereas when your quadriceps are getting contracted, it is extending the knee. Okay, so these two muscles are counter of each other, opposite of each other. To keep your knee straight, it is very necessary to track the patella, pull the kneecap. How to track the patella or pull the kneecap? So if you can see, observe me, this is my kneecap is relaxed now, and then I am tracking it like this. Okay, so this tracking the patella, pulling the kneecap using your quadriceps, that is important to keep your knee straight or to protect your knee joint. If somebody is having osteoarthritis, knee joint pain, swelling in the knees, pain in the knees, if you go to the orthopedic surgeon, the best exercise for the knee joint pain is to track the patella, or to protect yourself from the knee injuries, to track the patella, pull the kneecap. That is the most important thing for the knee joint. It will strengthen your knee ligaments. So this is the importance of pulling the kneecaps or keeping the quadriceps active, front thighs active. Okay. So how many parts of the body you should consider during asana practices? Neck and shoulders should be relaxed. Then abdominal connection. Then buttocks connection. Back thighs and front thighs connection. That's it. That's it. If you understand those parts, or if you consider those parts, if you keep in your mind those parts properly, you won't have any problem, any injury at all. And if you understand those things, your teaching will be very different, unique teaching, and you will be appreciated, I am sure. Okay. So whatever the asana, next slide please, whatever the asana practices you have performed without any instructions, now after understanding all those connections, you are going to perform those asanas, but with my instructions, and I am giving the instructions, and accordingly you try to follow those instructions. You will be able to enjoy those asanas more intensively. Okay, this is about the ankle joint, your calf muscles. Okay, this means the bigger muscle of the calf is gastrocnemius, and the soleus side muscle is the soleus. The red muscle is the soleus, and blue muscle is the gastrocnemius. That is also many times you get the cramps because of the weakness of the muscles. Then what to do? Strengthen those muscles. How? Let us see how to strengthen those muscles. In Setu Bandhasan, you perform Setu Bandhasan, you perform Bhujangasana. Now in Setu Bandhasan, how it is intensive, you feel it very easy, is it? Setu Bandhasan. But it will be very intensive now with the connections. How, that I will see. Now please lie down again, all of you. I'll request all of you to adjust your camera in such a way that I can observe you in lying down position and in sitting or standing position also. So keep your camera a little away from you and not in a portrait mode, in the landscape mode. I should be able to see your whole body from the tip of the toes to the top of the head. Okay. Now please join your legs together, heels and toes together. Hands are resting by the sides of your hips, palms facing down. Keep your hands, shoulders, neck and face relaxed. Look to the ceiling exactly in front of you. So keep dropping your chin towards the throat. Lengthen the back of the neck. Do not allow your chin to go away from the throat. Now first, engage your abs, tuck the belly button in. And keep tucking your belly button in, connecting your abs properly. Close the bottom rib. Do not allow your bottom rib to pop out. Breathing continue. Now pull the kneecaps, track the patella, front thighs active to keep your knees straight. Maintaining the abdominal connection and front thigh connection, then very slowly lift your both legs up to 30 degree only without jerk. But keep your belly button in, shorten the obliques, slide the rib cage down. Now reach up to 45 degree. Shorten the obliques, tuck the belly button in, engage your abs. By shortening the obliques, sliding the rib cage down, automatically your lumbar curvature is becoming flat on the ground. Lower back is flat on the ground. Now try to reach up to 60 degree, keeping your knees straight, pulling the kneecaps, front thighs active, track your patella, breathing continue, neck, shoulders relaxed. Do not allow your chin to go away from the throat. Don't press your palms on the ground. Pull the kneecaps. Now try to reach up to 60, 70, 80 or 90 degree. Lower back flat on the ground. Keep closing your bottom rib. Belly button in. Breathing continue. Knees straight. Abs in. Neck, shoulders relaxed. And face also relaxed. Maintaining the connection, abdominal connection, keeping your knees straight and legs together, very slowly release up to 60 degree. Don't lose your abdominal connection. Maintain the lower back flat on the ground. 45 degree. Maintain the abdominal connection, knees straight. 30 degree. And then on the ground. Relax for a while. So in this way, when you are connecting your abs from the beginning, you will feel more pressure on the abdominal region and little pain in the abdominal region in the beginning. This will strengthen your abs by connecting you. So this is important thing. Now the next position you are going to perform is Setu Bandhasan bridge pose. Okay. Now in Setu Bandhasan bridge pose, again first legs together. No, proceed with my instructions. Keep your legs together first. Hands close to the hips on the ground, palms facing down. Now bend at your knees. Fold your knees. Take your heels close to the hips, as close as possible. Not forcefully, not with struggle, without struggle, easily, feet flat on the ground. Now part your feet a little, 4 to 5 inches or hip distance apart. Hip distance apart means not the waist width. Hip means your hip bones or sit bones or ischiums. Keep your feet flat and parallel to each other, 4 to 5 inches away from each other. But keep working with your inner thighs adductors. Imagine you are holding a fold of a newspaper in your knees and it should not fall down. Okay. Keep holding a fold of a newspaper or fold of a magazine in between your knees and it should not fall. That means you are squeezing, you are pressing your knees and thighs on each other all the time. Okay. Feet apart, knees together. Feet should not be together. Feet apart, knees together. Okay. Maintain that inner thigh connection. Now first tuck the belly button in, connect yourself. Now squeeze your buttocks and back thighs, shooting the tailbone in. Slowly from tailbone to the upper thoracic, one by one vertebrae will fly off the ground. Keep squeezing your buttocks and back thighs, shoot the tailbone in. Go in the spinal extension so that your chest is coming to the chin and you are opening the hip flexors. Keep squeezing your buttocks and back thighs, hamstrings. Knees and thighs together. Keep holding the fold of a newspaper in your knees. Breathing continue. This is very good to strengthen your buttocks and back thighs as you are connecting them. When you are keeping your knees and thighs together, you are working with your adductors. It will improve the strength of your adductors. Then to improve the strength of your calves, very slowly lift your heels. Keep your knees, thighs together. Do not drop your hips down. Keep squeezing your buttocks and back thighs. Now very slowly, without dropping your hips, only heels on the ground. So movement will be at the ankle joint only. Again, heels up slowly. Heels down. Heels up. Now keep your heels up, knees, thighs together. Imagine you have a small ball in between your knees and you want to squeeze that ball more using your inner thighs. Okay. So I am going to count numbers and with my each count you are going to give the you are going to squeeze your thighs together, knees together. It's 1, squeeze it, release. 2, squeeze it, release. 3, squeeze, release. 4, squeeze it, release. And 5, squeeze it and keep squeezing it as it is. This is to improve the strength of your inner thighs. Now to improve the strength of your tailbone, couple of centimeters drop your tailbone down and again squeezing your buttocks and back thighs, pick it up. Drop your tailbone down and pick it up. 2 centimeters, tiny movement, down and squeeze it up. Down and squeeze it up. Down and squeeze it up. Down and up. And stay here. Now release your heels first. And then from upper thoracic to the tailbone, landing your one by one vertebra at a time. Articulation of the spine, one by one. So from the flat back, then you will be in the curvature of the lower back. Release. How your buttocks are saying good morning, good afternoon, good evening to you? Are you okay? Your buttocks are saying something to you? You will remember. Okay, how they are saying, how they are enjoying. After a few breaths, now you are going to perform Pavan Muktasana, counterbalance. Because in Setu Bandhasana, your front part of the body is getting stretched, back part of the body is getting contracted. Now back part is getting stretched, front is getting contracted. So again, legs together, bend at your knees, then take your knees to the chest. Now hug your knees with your hands, either making a finger lock or holding at the wrists or at the elbows, whichever is comfortable for you. Neck, shoulders relaxed. Breathing continue. Now without hiking your shoulders, please listen the instructions carefully. Without hiking the shoulders, without lifting your shoulders to the ears. Shoulders are reaching away from the ears. Then without throwing the head forward or without jamming your chin to the chest, engage your abs, shorten the obliques, and shortening the obliques without support of your hands. Lift your upper body, lift your head, neck, shoulders, and upper back. And try to bring your knees and face close to each other. I have not given the instruction to raise up your head only. I said lift your head, neck, shoulders, and upper back. All together. Do not throw the head forward. Do not jam your chin to the chest. Do not hike your shoulders. And make sure that you are able to maintain your maximum body weight on the lower back, on the lumbar spine, not on the middle back. So use your hands to pull the knees towards the chest to press the thighs on the abdomen. Don't use your hands to come up or to maintain the upper body. Breathing continue. If you have strain in your neck, that means you have lost your abdominal connection, or you don't have enough strength in your abdomen. That is why you get the strain in the neck and shoulders. To come back slowly, release your head and upper body first. Release your hands, then release your legs. So usually in Pavan Muktasana, we have learned and we are giving the same instructions that after hugging your knees, raise up your head and try to touch your chin to the knees or try to touch your forehead to the knees. When you try to touch your chin to the knees, immediately you throw the head forward. When you try to touch your forehead to the knees, you jam your chin to the chest. That is why what should be the instruction in Pavan Muktasana? Lifting your head, neck, shoulders, and upper back together. Or curl up from under the chest. Or lift your upper body. Upper thoracic flexion is there. In Pavan Muktasana, there is a upper thoracic flexion. So not only head neck flexion or not only throwing the head forward. I am not saying that you are teaching in a wrong way or you have learned in a wrong way, but I am adding some new things in the current things. Whatever you have learned is okay, but I am adding some new things which will help you which will protect you and your students. Okay. So instead of now onwards, instead of giving instruction to raise up your head, give the instruction to lift upper body, head, neck, shoulders, and upper back. That will help you much more to increase the intensity level also. Okay. Now please come on the abdomen in a prone lying position for Bhujangasana. In Bhujangasana, first your legs together, heels and toes also together. That is necessary. Toes are pointed back. Okay. Now, forehead on the ground, place your palms by the sides of the chest. Elbows are pointed up. Keep your elbows close to each other, close to your torso. Do not spread your elbows out. Shoulders sliding down, scapulae sliding down. Do not hike your shoulders. Shoulders are retracted. That means your scapulae are coming close to each other, close to the spine. Okay. Now, first squeeze your buttocks and back thighs. Imagine injections, both sides. Okay. Now keep squeezing your buttocks and back thighs so that your center bone, pubic bone, and your pelvis will be anchored down all the time. Keep working with your inner thighs so that your legs will remain together. Inner thighs active. Heels together, toes together. Now engaging your abs and without support of your hands, slowly lifting your upper body, lifting your head, face, chin, shoulders, chest, but keep connecting your buttocks, back thighs, and inner thighs. Breathing continue. Don't take support of the palms now. Palms are as it is close to the on the ground by the sides of the chest. Breathing continue. Do not hike your shoulders. Shoulders sliding down. Heels, toes together. You can go in the extension from the neck also, as much as you can, but not the hyperextension. Now, with the support of your hands, you can go little further for Sarpasana. You try to lift your upper body till the pelvis. But pelvis should be, hips should be on the ground. Till the lower abdominal region, you lift up yourself. But shoulders sliding down. Do not hike your shoulders. Elbows remains close to the torso. Elbows should not be straight. Bend at the elbows little. Yes, then only you will feel the intensity of this asana at the abdominal region. Breathing continue. You'll have to connect your abs in this position. If your elbows are straight, then you lose the abdominal connection. You won't feel anything. Keep your inner thighs active to keep your heels and toes together. See your legs are how your legs are going away from each other. So keep your inner thighs active. Slowly, without hiking your shoulders, without jerk, with control, come down. Please release and relax. So when you perform those asanas, especially Bhujanga asana, in the beginning without any understanding and without any connection, and now I hope you felt some difference. If you have connected or if you understood properly. Now sit back on your heels in Vajrasana. Sit straight. If anybody is uncomfortable in Vajrasana, you can sit in a cross leg. Don't force yourself. Sit straight. Keep looking at the eye level in front of you. Now, not necessary to look at the screen. You just listen my instructions. Okay. Look at the eye level in front of you. Dropping your chin down, push your head back. That means lengthen the back of the neck and look at the eye level. Don't drop your head down. Push your head back like this. Okay. Don't throw the head forward. Now hands by the sides of the body. Okay. Now tuck the belly button in, engage your abs, close the bottom rib, maintaining the abdominal connection all the time. Keep closing your bottom ribs all the time. Don't pop your ribs out. Now slowly stretch your hands at the shoulder level by the sides. Imagine your rib cage is getting stretched, getting open to the lateral sides. Now turn your palms up. And with inhale, imagine expansion of the rib cage to the lateral sides and circle your hands with inhale towards the ceiling. But keep closing your bottom rib. And now, after stretching up, join your palms together. Breathing continue, but breathing should be from the upper thoracic region. Tucking the belly button in. So that your back will remain in the natural curvature, not going in the hyperextension. Don't throw the head forward. Dropping your chin down, keep pushing your head back. Lengthen the back of the neck. And if you look at your chest, your rib cage, you will feel with that inhalation, your rib cage is getting expanded to the lateral sides of the body with inhalation. You can take a little deep breath, but keeping your belly button in, closing the bottom rib. Don't pop your ribs out. Now very slowly take your hands at the shoulder level, then turn your palms down and then release your hands. Release. Please relax. Now this is the same connection is applicable in Tadasana also, in Uttan Mandukasana also. So not necessary to perform Tadasana. Okay. In Parvatasana, you understood that connection. Have you found any difference in performing asanas? Without understanding anatomical connections or scientific understanding, and after understanding the connections, is there any improvement in the intensity of the asana or performance of the asana? Is it? So this is the scientific understanding of asana. These are some examples. I observed before understanding, when I asked you perform same asanas, in Bhujangasana, I observed some people in this position. For example, in Bhujangasana, you are here, like this. Whereas, after the instructions, you are here. Then in Pavan Muktasana, the position in Pavan Muktasana was, after this was here. And after instruction, after understanding, it is here. Okay. This is the difference. And in Ardhalasana also, the same thing. If you lose the abdominal connection, immediately it creates pressure on the lower back, lumbar spine. Okay. So these are the things we should keep in your mind during asana practices. As a yoga teacher, yoga therapist, yoga instructor, yoga master, at least this much knowledge everybody should have. We are going to understand some other connections or other anatomical understanding, scientific understanding of asana tomorrow. Some different moments of the spine and body, especially abdominal muscles. For example, when you are bending forward, your obliques are getting contracted. Internal and external obliques are getting contracted. That is why you are bending forward. When you are going in the extension, your internal external obliques are getting stretched. That is why you are going in the extension. When you are twisting, rotating your spine to any side, for example, clockwise rotation, right side twisting of the spine, that time this moment is known as contralateral obliques work. Contralateral obliques means the same side internal oblique and the other side external obliques are getting contracted. That is why the twisting is happening. Whereas for the side bending, lateral bending of the spine of the torso, it is known as ipsilateral obliques work. That means the same side internal and external obliques are getting contracted and other side internal external obliques are stretched. That is why the side bending is happening. In short, while giving any kind of movement to the spine, your awareness should be on the contraction of the abdominal muscles. Primary contraction, primary awareness should be on the abdominal region, abdominal muscles, and then spinal muscles or back muscles. Why? To protect yourself from the injuries and to feel the more intensity, more effect of those asana practices. This will, because of that connections, it will improve the, it will strengthen those muscles. Then all the internal organs are getting stimulated properly because all the important organs are available in the abdominal region. Liver, pancreas, intestine, kidneys, all those organs are in the abdominal region. And to maintain the proper health of the body of the individual, the first thing or important thing is your digestion. If your digestion is proper, chemical digestion is proper, everything will be okay. Be it indigestion, constipation, gases problem, then diabetes, high blood pressure, heart problems, everything. The root cause is here in the digestion. So that is why to activate your gastric fire properly, to activate and stimulate your internal organs properly, working on the abdominal region is necessary. Okay, so this is our scientific understanding. If you have some questions, please be prepared with the questions. Tomorrow at the end of the session, we will discuss about all those questions and answers. Okay, so in a quick time, if you have any doubt only, any suggestion only, not the question, but any suggestion, how we are going on, how we are okay. Are you okay? So if you are okay with this, thank you so much. And we'll meet tomorrow again with some new things also. Till then, please sit comfortable. We'll end the session with Shanti part. Sitting comfortable and straight, eyes gently closed, hands on your knees, preferably in a Jnana Mudra, symbol of knowledge. Be aware of your breath, your moment of prana. Speed and depth of your breath, and moment of the abdominal region during inhalation and exhalation. Normal, natural breathing process. and try to analyze yourself before, during, and after the discussion. Try to observe the changes and effects of our understanding, our practices at the physical level, gross level, and at the psychological level, emotional level, and intellectual level. That means at the subtle level. So the experiential aspect is more important. Try to observe the silence, peace, calmness, coolness, pleasure, and happiness around you and within you. Feel the positive energy around you and within you. Now, slowly take your hands in Namaskar Mudra, prayer position. Om Purnamada Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnamevavasishyate. Om Shanti Shanti Shanti. Thank you. Namaste.